Hey there! Welcome to our channel. In this video, we are going to discuss Ultimate Dental Hygiene Guide, Achieve Healthy Teeth. By the end of this video, you'll be able to improve your dental hygiene routine and prevent common problems like cavities, gum disease, and bad breath. So, without further ado, let's get started. First things first, let's talk about brushing. Brushing your teeth is an important part of maintaining good oral hygiene. It helps to remove plaque, which is a sticky film of bacteria that can cause cavities, gum disease, and bad breath. Brushing your teeth also helps to keep your teeth white and your smile bright. Brush your teeth at least twice a day, in the morning and at night, for at least 2 minutes each time. Remember to use gentle, circular motions and brush all surfaces of your teeth, including the gums. Don't forget to reach the back teeth and brush your tongue too. You should replace your toothbrush every 3 or 4 months. Here are some steps to follow when brushing your teeth. Wet your toothbrush and apply a pea-sized amount of toothpaste. Hold your toothbrush at a 45-degree angle to your gums. Gently move the brush back and forth in short strokes, covering 1 or 2 teeth at a time. Brush the outer, inner, and chewing surfaces of each tooth. Use the tip of the brush to clean behind your front teeth, both on the top and bottom. Brush your tongue gently to remove bacteria and freshen your breath. Spit out the toothpaste and rinse your mouth with water. Now, let's move on to flossing. Flossing teeth is a way of cleaning between your teeth using a thin thread called dental floss. Flossing helps to remove food particles and plaque that a toothbrush cannot easily reach. Flossing has many benefits for your oral health, such as reducing the risk of gum disease by removing plaque from below the gum line, freshening your breath by removing bacteria and food debris that cause bad odors, keeping your teeth white by preventing stains from forming between your teeth. To floss your teeth properly, you need to follow these steps. Gently slide the floss between your teeth, curve it around each tooth in a C shape, and ensure you reach the gum line. Keep your flossing technique consistent and thorough. Hold the floss tightly between your thumbs and index fingers and guide it between your teeth using a gentle rubbing motion. Gently slide the floss into the space between the gum and the tooth and rub the side of the tooth with an up and down motion, following the shape of the tooth. Spit out any debris and rinse your mouth with water. Next up is mouthwash. Mouthwash is a liquid product that you can use to rinse your teeth, gums, and mouth. It usually contains an antiseptic that can kill harmful bacteria that can cause cavities, gum disease, and bad breath. Rinse with an antimicrobial mouthwash to kill bacteria and freshen your breath. Make sure to follow the instructions on the bottle for best results. Brush and floss your teeth first. If you use fluoride toothpaste, wait for some time before using mouthwash to avoid washing away the fluoride. Pour the recommended amount of mouthwash into a cup or measure it with the cap. It is usually between 3 and 5 teaspoons. Swish the mouthwash around your mouth for about 30 seconds. Do not swallow it. Spit out the mouthwash and rinse your mouth with water if needed. Don't forget about your diet. A balanced meal with plenty of fruits and vegetables is essential for healthy teeth. A healthy diet for your teeth is one that includes foods that are rich in nutrients and low in sugar and acid. Some of the best foods for your teeth are dairy products, such as cheese, yogurt, and milk. Fruits and vegetables, especially those that are crunchy and high in fiber. Green tea, which contains catechins, antioxidants that can inhibit the growth of plaque-causing bacteria and reduce gum disease. Some foods that you should avoid or limit for your teeth are sugary foods and drinks, such as candy, soda, juice, and pastries. Avoid acidic foods and drinks, such as citrus fruits, tomatoes, vinegar, and wine. Avoid coffee and alcohol, which can dry out your mouth and reduce saliva flow. Remember, preventive care is the key. Schedule regular visits to your dentist for checkups and cleanings. Your dentist will detect any early signs of dental issues and keep your smile shining. Thanks for watching our Ultimate Dental Hygiene Guide. If you found this helpful, subscribe to our channel for more oral health tips and tricks. Take care of your teeth and stay smiling.